I'm sure that you were patiently waiting for the program. Good afternoon. We are back once again, ladies and gentlemen. Now, that's been caused for the last couple of weeks for us to discuss bronchitis. And of course, last week's show was quite amazing, though a lot of people came through as well trying to find out exactly the difference between, asthma and, of course, bronchitis and so on and so forth. And I did promise you that, well, I'm going to find somebody who can come and educate us more on the issue of bronchitis. So our topic of discussion today on Ask the Pediatrician is bronchitis, and my guest is Professor James Chipeta, who is coming through for the second time on the program. Is going to help us more to understand what bronchitis is all about. The text line is 0955 5070, 0955 5070. You can begin sending in your questions and of course your observations and all your experiences as well, and I'm sure that Professor Chipeta should be able to respond to that. Professor, good to have you once again, and of course welcome to the program.
Thanks very much. It's also my pleasure to come back.
For the last couple of weeks, people have been asking us to discuss the issue of bronchitis, and I thought you could actually educate us more on bronchitis. Last week we covered asthma, and one of the major questions that people kept on asking is, what is the primary difference between asthma and bronchitis? Perhaps we can start our discussion from there. What is the difference between asthma and bronchitis?
Good. So I think it's good that a very unique difference and also unique difficulties to distinguish between bronchitis and asthma was identified. And the reason is because in terms of the manifestations of asthma and manifestations of bronchitis in children, by the way, bronchitis as a term in children, on the clinician side, the doctor's side, we don't usually use it. It's more limited maybe to adults, but it does occur in children, and we will, as has been asked, try to, clarify. Now, the difficulties to distinguish between bronchitis and asthma, as I was about, just to explain, is that the manifestations or the symptoms are very, very similar, or in other words, in most cases, identical. We know that in asthma, you tend to have some sort of a chronic or long-standing cough. A cough that is dry and is disturbing but doesn't last. Similarly, in bronchitis, there is a cough. Okay, but I would want quickly to, zero in making a definition of bronchitis or explaining the term bronchitis in children as we understand it. Mm-hmm. Yeah. Now, which will really make it distinct from asthma. Okay. Now, bronchitis in children is part and parcel of conditions that we would call, the airway respiratory, diseases of childhood. Okay, so in that entity we have a number of, airway disease. Acute respiratory tract infections is really the entity which bronchitis, especially in children, falls in. Okay. Now, already I've said here acute respiratory tract infection. In other words, infections of the airway disease or of the windpipe, okay, in children. Whereas asthma is not, an infection as such, but it is an airway disease. So that could be the first broad distinguishing explanation that we need to appreciate, because when it comes to symptoms, very, very similar. Okay. The second thing that we need to state is that the majority of bronchitis, if not all, in children, and we usually use the word bronchiolitis, are short type of, airway disease. In other words, they are acute, other than chronic. Though in a few cases you might have chronic, that could be pointing out the type of, cause of that bronchitis in children. Now, again, that makes it very distinct from, from asthma. Asthma, as I said, is not caused by an infection. It's hereditary. I think the program last time, might exhausted all that. it's more of a reactive, airway disease. Okay, in terms of bronchitis, the majority of it in children is due to infection, and most of it is virus.
Okay.
And the flu-like or flu-causing type of viruses that actually are the whole main cause of bronchitis. Now, I think maybe quickly we may need to go into the symptoms, the manifestations, so that we see that why it can be confused with asthma. So as I already said, the major symptom or manifestation of bronchitis, like it is in asthma, is a cough, and they tend to be relatively, some sort of a wet cough because of very, very large, secretions that are formed from the airway, which is also similar in terms of asthma, that you have secretions that are formed in the airway, and you have this cough that in case of asthma is long lasting. In case of bronchitis, the one that is very common in children is very, very acute and short in duration in terms of the period that you have. So cough, very common. Okay.
What kind of cough are we talking about here?
Yes.
Dry cough, cough with.
So I said for bronchitis, mainly it's a wet cough, which is very similar to the wet cough that you might get in asthma, in that you produce these secretions. In case of asthma, it's reactive, okay, because asthmatic people, they're more or less like, should we say, in inverted comma, allergics like, okay, they tend to react to certain factors that trigger their asthmatic attack, a number of factors that could do that. While in case of bronchitis, it's an infection, and most of it, I said, is flu-like infections that cause this. So they will start with a cough, but beside the cough, okay, which might be very much a distinction against asthma, is that there will be a low-grade fever. Okay, there will be temperature, body hotness. Okay. And the body hotness is not very high, it's a low body hotness, which is very unlike asthma. Asthma, unless you have secondary infection, there will be no fever, no body hotness. But in bronchitis, there will be a low-grade fever.
How about those attacks, episodes that asthmatic people usually tend to have time and again?
Good.
Do people with bronchitis or children with bronchitis, do they also have such kind of attacks?
Good. So that is a third symptom. We've mentioned cough, which tends to be a wet cough. We've mentioned fever, which in asthma is not there, but in bronchitis is. Now the third symptom is wheezing or noisy breathing, which is a cardinal sign for asthma, but also it's a very, very, I would say, the severe, manifestation of bronchiolitis or bronchitis. Okay, and so they will wheeze. Now the wheezing, both in asthma as well as in bronchitis in children, is a sign that your airway, or your windpipe are congested. They have become narrowed because of swelling of the airway, and therefore the passing of air through this tight, congested, swollen airway is making, that sound that you hear in asthma, the wheezing. Also, it does happen in bronchiolitis, that you hear the noise breathing, the wheezing. But also, at the same time, besides just the breathing sound that you hear, is that actually the chest is tightened in terms of breathing, is limited. And that happens in asthma and also happens in severe bronchitis. So I would rather, for the clinicians, we use bronchiolitis. Bronchitis, as I said, is limited more to adults and not in a common term that we use for children.
When we look at statistics here in Zambia, what do they show in relation to the frequency of bronchitis among children in Zambia?
Good. Very important question also. And I think this ought to be emphasized. I was very excited. That's why I was excited to have come here. Is that currently, if we look at the top 10 causes of admissions of our children to hospital, the acute respiratory tract infection or acute respiratory diseases is topping the top 3. Okay? Of course, we have pneumonia there. And amongst the pneumonia-like conditions, which is the lower respiratory tract infection, we have bronchiolitis or bronchitis. So it is worldwide, it's the commonest cause of hospital admission, commonest cause of rapid, admission not only to hospital but also, worsening of the condition, so that such a child immediately needs intensive care unit. Okay, we will discuss maybe later on why they need all these hospital admissions and then ICU. So it's a very, very high disease burden, in worldwide, and in Zambia, it contributes to about a quarter of our admissions. Okay, to almost a third of our admissions, and of late, it has it has overtaken, in most cases, malaria. Malaria used to be the top cause of admissions for most of the children, but now pneumonias, the acute, respiratory infections, and in this case, bronchitis, bronchiolitis, are the cause. Second is also the top causes of death in children that are admitted in hospitals. Very, very, the cause of death in terms of mortality rate, very, very high, especially with children of certain risk. And generally, we see bronchiolitis or bronchitis in children that are less than 1 year or up to 1 year. And especially children less than 6 months, they are very much prone to bronchitis or bronchiolitis. And it's a very, very, life-threatening condition. So that's, the frequency that we have asked for. It's one of our top causes of admissions in hospital. It contributes to about a quarter to a third of our admissions in hospital.
When you look at some of the other, conditions and of course infections, such as, asthma itself, you'd find that there are some physical pain that, an asthmatic person could actually be going through. Is that the case with bronchiolitis as well? Are there any physical pain when the attack happens? And is it a seasonal infection?
Good. So you have about 3 questions there. First one, before I forget, is pain is definitely there, and probably much, much pain than maybe you would experience in asthma. And the reason is because you have the acute inflammation part of it, because it's infective, it's very much on the extreme. Okay, I think most of us do know that commonly pneumonia in our common understanding is what is called calaso. And calaso is not, a comfortable ailment. When you have calaso, you are in pain, and very severe chest pain. And so is bronchitis, bronchiolitis that we are discussing here in children. It's a very, very severe chest infection, okay, and lower, respiratory tract infection, causing a lot of pain in our common understanding, calaso. So that's what really we are discussing here. Okay, of course, they are the larger part of causes of calaso in terms of pneumonia, but we are, emphasizing here of bronchitis or bronchiolitis, which is mainly, viral in its cause, while most of the other calaso, the pneumonias, is in our setup is mainly bacterial. Now, the other question that you asked was the aspect of is it the frequency or the frequency or
Exactly. Apart from pain, obviously the other aspect that I wanted to find out is when you look at the manifestation of bronchitis in children, how can a parent really get to know that this is bronchitis?
Okay, good. So, what would make a parent or anyone notice that this is bronchiolitis or bronchitis is, as I said, unlike asthma, this is an infection. So this would be a child who all this other time was okay. And the first thing that will happen is that they will have a flu-like, illness. They will have a running nose. They will have congested nostrils, okay? And then, of course, they will have a cough. And this will happen within just a day, but within 2 days or so, it will progress and worsen to rapid or fast breathing, okay? So they will have congested chest, that leads to fast breathing or rapid breathing. And then they will quickly, within the next 1 or 2 days, alongside with a low-grade temperature, they will, go into what I would call, some sort of severe signs of bronchiolitis or bronchitis. They will have some sort of reduced oxygenation. Okay, so their oxygen saturation in the body will just drop. Okay, and because of that, they will have bluing of the mouth or bluing of the extremities, which what we call cyanosis. And then they can go on to what I would then call to some sort of life-threatening, signs. And at that stage, they may go into some sort of decomposition where they are now failing to sustain breath. So there's be stages in between the breathing where breathing is ceased or stops, what we call in the clinical settings or in the hospital setting apnea. So they are actually now almost going to respiratory failure, where they will fail to breathe, to initiate the spontaneous breathing. And all these would of course point to that this most likely is bronchiolitis. Now, the catch thing, other than the other coughs, because we have cough for TB, cough for R, is that it's acute, it's short onset, okay? But also, it's a wet cough, okay? In other words, even as the child is coughing, you will hear that wetness of the cough. And then, of course, as we have already said, there will be this noisy breathing, the wheezing, okay? But this, for example, you would distinguish is not an ordinary pneumonia. It's more of really pointing to bronchiolitis, okay? But of course, we do know that in children, you can sometimes confuse between asthma and bronchiolitis. And a few of these children that will tend to have bronchiolitis type of episodes, if it's repeated, okay, might be the ones that actually are in families where there's asthma, and then they will progress to, in their older age, beyond 2-3 years, have established, asthma. But the classical or the very typical bronchiolitis is an acute, illness. It can last up to 2 weeks if it's not intervened, but if one survives, but not more than that. If it becomes chronic, then you should be suspecting maybe you are dealing with asthma or the like.
You're still watching Ask the Pediatrician, and of course our topic of discussion today is bronchitis. Your messages are coming through on 0955 5070, 0955 5070. We now go for a short break. When we come back, we get to some of the text messages that are coming through.
It's learning time and playtime. You know what they say. All work and no play makes Jack a dull boy. Join the adventure. Let's create, let's explore, let's grow, and let's discover. Tag along and join the coolest club, Q Club, every Mondays at 16:30.
plan is running smoothly.
My confusion is, how did it leave this table and found itself on your table?
I've just noticed you're a quiet guy.
Hey, bossy. Like the last time, you show your faces here. Otherwise,
I'm now spoiling our marriage. Based on us having children, that's me spoiling our marriage.
Finally, you got what you wanted, eh?
Do you know I can strangle you right now? Do you know what you've made me go through?
Your favorite music video show. In terms of music videos, we have the latest, the most trending, the most happening.
Zilile, man. Remember, say I told you we're chilling with the prettiest and coolest girl on TV road. So stay glued to QTV, log on.
In 3, 2, 1, and it's Ilyashi with Tal with a brand new 4-episode segment. Now, this segment is called The Viewer's Choice. Tell me about it. You want to know about it? Obviously, yes, you do, because you've been following Ilyashi and you have been a loyal fan, watching every single episode, posting about what you like about it and whatnot. So who am I to stop you from being a part of this goodness as a fan? So if you want to be on this episode, make sure you like our Facebook page, QTV Zambia, and inbox us with the hashtag Ilyashi with Talu and tell me why do you want to be on Ilyashi with Talu. After that, we're going to shortlist those people that we feel have interesting reasons, and then they have interesting reasons to be on Ilyashi with Talu. After that, we'll get your numbers, ask you to send us a video, and once the videos are in, we're going to have an actual episode dedicated to watching those videos as to why you want to be on Ilyashi with me, your girl Talu. Now after that, you, the viewers, have a say. You have a choice, hence the viewer's choice. So you're gonna pick which 4 people you'd like to see on Ilyashi with Talu on the next coming 4 segments. So get involved. Go to our Facebook page, like it, send me that inbox with the hashtag Ilyashi with Talu and why you want to be on the show. You see that we love you? Yes, we do. So make sure you do everything that we're asking you to. Bye-bye.
All right, so welcome back, ladies and gentlemen. 0955 5070 is the text line that you're getting in touch with us on. Okay, so our topic of discussion is bronchitis, and of course the first text message is actually asking is in line with what I was thinking. This one is coming through from Mr. Skazo, who is asking, does the cold weather have an effect on the manifestation of bronchitis? Actually, I wanted to also find out from you whether bronchitis has got it has got a season or not.
Seasonality. Yeah. So I think that's the question that I missed when you had asked earlier on. So yes, the bronchitis, especially in children, and bronchiolitis, as we usually term it in the hospital setting, is very much seasonal, and it has very close correlation with the cold, warm season. Okay, so winters tend to be very, very prone to bronchitis, and it's even here in Zambia, in Lusaka, in most of our hospitals, we get high admissions of children with bronchiolitis around May, June, July, thereabout. So times when we have a bit of cool, cold weather, and it appears to be related to the most common virus that causes bronchiolitis in children, which is a flu-like virus that is called respiratory syncytial virus. So 70% of the children that have bronchiolitis is because of that virus, and it tends, this virus multiplication or the outbreaks is very much alongside with the cold cool season. Yes.
Interesting. We get to Mazabuka. Munguza is also asking there, I have a baby born at 7 months, has the symptoms for bronchitis you have stated. What is the treatment and preventive measures?
I'm very happy that that parent has come up with that question, because one of the things that I thought we could have discussed was what are the risk factors of bronchitis or bronchiolitis. And one of them, as I said, was age less than 1 year, and more worse, those babies less than 6 months. And then within the other factors is prematurity. I hear this baby was born at 7 months of pregnancy. So prematurity or premature delivery, a premature baby is more prone to, to bronchiolitis or bronchitis. The other risk factors are chronic, lung diseases. In children, we think of things like, asthma itself, or, those that have other chronic chest problems, okay? But also chronic medical conditions like congenital heart diseases would make babies or children prone to bronchiolitis. But then we also have environmental factors, okay? If children are in overcrowded places, okay, that also is very high, susceptibility to bronchiolitis. So I would really advise the parent that has just asked that question to immediately actually take the baby to be seen in the nearest hospital, okay? Because the prematurity in a baby is making the baby susceptible to bronchiolitis. Yeah.
Elijah, 27 years of age, says, I have asthma. Now I have a problem of having a body rash. Now what could be the problem?
Okay. Yeah. So the asthma, as I think might have been discussed by my colleagues last time, is very much within the allergic tendency of a person. Okay. It's a condition that is as a result of the body reacting to outside factors or antigens that makes one's lungs or airway passages be very reactive, and so it's some sort of an allergy. Okay, so it's not probably rare to have an asthmatic patient also have some skin rash that are to do with some sort of allergic tendency. So I would advise the caller to actually visit the physician that is attending to, or clinician that is attending to him, and check out what that skin eruption is. So if it's just simple an allergy, then he should be treated accordingly, the way we treat allergic rashes. Okay, if it is a rash that is to do with some infections or some other problems, then it will be dealt accordingly. But I'm very much sure that this could be part and parcel of his, tendency to allergy as an asthmatic.
Mr. Banda here says, what is the main cause of bronchitis in adults?
Okay. I was almost trying to say we are not discussing adults, but since adults also attend to our children, I would have the privilege to, just outline. So in bronchitis in adults has many, causes, but the most common cause that adult bronchitis is associated is really occupational. Okay, so people who work, let's say, in mines, they tend to have dust that would collect over time in the lungs, and that will create this tendency to have bronchitis. People who in the past who used to work with certain companies that were, producing asbestos, there was a certain certain roofing material that was made out of asbestos, also had a tendency to have lung, problem that will end up bronchitis. But again, in the recent past, certain chronic infections like HIV was associated with some sort of, chronic lung disease that would end up with a bronchitis type of manifestations. But of course also TB, because of its destructive nature of the lung or the airway over a long time, can also present as a comorbidity or problem of bronchitis. So I would rather anyone with signs and symptoms with an adult of bronchitis be, visit the hospital, visit clinicians so that they sort out what is really causing their bronchitis.
Good afternoon, Professor. My girl has been complaining for months now. The area connecting the mouth and the nose becomes blocked, and when this happens, she experiences headaches and some kind of tinkling sensational on the back of her neck, going down the neck. What problem could that be?
Yeah. So first and foremost, though the mom has been very elaborate describing the symptom, I would say we would really know what that could be if we can see that child. Okay, but just on the outlet to answer mom is to say that the blocked nose, and then with also the mouth, more or less like she said, the passes between the
mouth
and the nose gets
exactly.
blocked. Yeah, that also can suggest many other things. If that has been recurrent and has been from the time of birth to now, one would be thinking, do we have some structural defects up there in the upper airway? We can have things like what we call polyps, okay, nasal polyps that can block the upper airway, okay. We can have many other defects that could be up in the throat, okay. Or is he having more or less like, if it's recurrent tonsillitis, and the tonsils are, enlarged and what we call hypertrophic, okay, they could cause what Mom has just described. But I think guessing from just that text and Mom's call would not do us good, but we better see that child and then see what really is happening. Yeah.
How is bronchitis diagnosed?
Good. So the diagnosis of bronchiolitis, I'm tending to use the word bronchiolitis so that I avoid the adult bronchitis, is very much on history, those symptoms that we have talked about, that they should be acute in nature, and then the physical examination. On the physical examination, the wheezing that we will hear audibly, you will also hear, besides that wheezing sound, you hear when you examine a child with bronchiolitis, more or less like what we call crackles or crepitations all over the chest. And these are sounds you hear with that, what we listen to the chest with as clinicians, the stethoscope, in terms of as if you are hearing the sound when you are in the bush. I hope most of us go into in the forest and you are stepping on dry leaves. That sound, rattling sound that you hear it in a congested chest where a child has bronchiolitis. Those clinical evaluations make the diagnosis of bronchiolitis almost very easy. But then in some cases you can support it now with some laboratory investigations. You can have chest x-ray that could give you pictures consistent with what would be bronchiolitis in children, but you can also do laboratory investigation to rule out other similar causes, like in asthma. We've talked about asthma, but also in centers where you can manage to isolate and grow the virus, you find that you isolate in the majority, as we have said, respiratory syncytial virus and other, bronchitis causing viruses. We have many, and as I said at the beginning, all these are flu-like viruses that cause airway infection. So that is how you make the diagnosis of bronchitis in children.
Can it be inherited?
Okay, so that is a very good question. That there's been a lot of debate over time first of the definition of bronchitis or bronchiolitis, so as to make it very distinctive from asthma. And it's because a fraction of children have a tendency to have congestive or reactive airway disease that has manifestations of a wheeze, which could be asthma or not asthma, is very, very, that a small portion of those type of children, they tend to have a familial tendency of asthma. And quite a good number of them, they'll end up with asthma. So in that sense, one would say it's hereditary. But definitely, bronchiolitis is not hereditary in the sense of the current definition that is infective process and mainly by viruses. Okay? But in the general sense, of course, the susceptibility to one having bronchiolitis or the infection of bronchiolitis, of course, could have some individuals or some families are more prone than others. And therefore, you would say there is that hereditary, but it is not a hereditary disease as such, as asthma is. And that's what actually makes it distinct from asthma.
Interesting. Okay, so now having made the diagnosis, some of the regular questions that are now coming in is it curable? Can it be prevented?
Good.
So maybe maybe you can answer them both.
Good.
Is it curable?
Well, so the question curable, I'm laughing because the answer that I want to give might mislead any one of us. Okay, it's not curable in the sense that the major cause of bronchiolitis is viral, and we know that the majority of our viruses, except a few viruses, and mainly the few viruses I'm talking about that we have a cure in terms of a drug, are the herpes group of viruses. But the majority of other viruses, we don't yet have actually a cure, a drug for them. Now, that's what I thought might be confusing. But in terms of it being treatable, it's very much treatable. And that's why I should emphasize that, yes, it's incurable in terms of the viral that causes it, okay? But the disease itself is treatable, and actually, if early detected and treated or supported, they can, the children are actually recover and, completely recover. Now, let me then answer the question in full in terms of the treatment, okay? So first and foremost, the prevention, okay? So except that in our case, we do not have access to that prevention, but we now worldwide, it's very well known that those that are at risk at bronchiolitis, especially children that are premature, okay, children that are very newborn, neonates, can be protected from bronchiolitis. And elsewhere, they give them some sort of, some immune treatment that they call palivizumab. Now, palivizumab is been well documented to prevent the occurrence of bronchiolitis in children, in infants that are at risk. Okay, and this is some sort of like an immune boost. Okay, it's a collection of antibodies that are specific. They counteract the virus that causes bronchiolitis and therefore prevent the occurrence of bronchiolitis. Unfortunately, we do not have access, limited access to palivizumab here in Zambia. So that's one. Second, we did here a study where we found that children that are admitted with very severe pneumonia, about a 30% are actually bronchiolitis and are actually caused by this very virus, the respiratory syncytial virus. And there is now work worldwide to come up with a vaccine against RSV. And we hope if that vaccine is developed, actually we can immunize our children against bronchiolitis. So that's in terms of prevention. In terms of treatment, the majority or the largely, the treatment for bronchiolitis is an emergency treatment, and it is supportive. Okay, so what happens when you rush a child to the hospital, and it has to be really a hospital or a health facility that can do these supportive measures? One is to make sure that the airway is patent. So they can do even some suctioning to make sure that the airway is patent. Okay, you can give immediately, as I said, there's reduced oxygenation of the body. They need to be given some oxygen so as to oxygenate the body. Otherwise, they'll go into, hypoxia or less oxygen and go into respiratory failure. So that supportive treatment is important. The mainstay treatment in bronchiolitis is to rehydrate the child, to rehydrate the neonate, to rehydrate the infant that has bronchiolitis, because the bronchiolitis itself makes them lose a lot of fluid by perspiration, and therefore hydration is very, very important. And also feeding. In the study that I mentioned again, we did note that actually most of the children that died, it was because nutrition-wise they were compromised, and therefore feeding and hydration is the mainstay treatment of bronchiolitis. The next part of treatment is you try maybe using some drugs to make the airway patent in terms of dilating the bronchioles or the windpipes. And so we have treatment that is usually given in the hospital that we call nebulization. Okay, this nebulization has an approach like what used to happen, or what happens with our grandmothers in the villages, where you have a bit of like steaming your nostrils and all that. But this steaming, the nebulization, is well guided and is with, in most cases, we use some drugs that we call bronchodilators, and these are just drugs that actually dilate, the airway so as it to be patent. That also treatment is very, very important, though it's controversial in terms of the usefulness of bronchodilators, but it helps very much so as to make the airway patent so that the child doesn't go into respiratory failure. The other aspect is that is still not very much debatable, it's been proven to be very helpful, is use of some drugs which we call steroids. And these are very important in the sense that they actually treat the inflammation, the irritation, the swelling that happens because of the infection in the airway. So use of steroids either in a steamed way, like nebulization approach way, is also very, very helpful in bronchiolitis. And there are also the aspect, because there are some times when actually children will go into severe stage where none of what I've said so far in terms of suctioning and all that can help. At that point, they will need an ICU care where they will be actually ventilated. The ventilation I'm talking about is that they will be held by a machine to breathe. Okay, that ventilation also is part of treatment, especially for the severe form of bronchiolitis. Now, all these forms of treatment that generally are not specific to treat and cure the virus, but to treat the results or the complications of the infection, are very, very much, I would say, using the word curable, or treating the disease that the child will recover if effectively given. Thanks.
How I wish we had a lot of time really to obviously just consume all the messages that are coming through, but unfortunately time is not with us really. But obviously, even as we wind up right now, just under 30 seconds or so, is it possible that someone or a child can have both asthma and bronchitis?
Okay, yes, it is very possible, Nelson, with the understanding, as I told you, that some of the risk factors for bronchiolitis is chronic airway disease or chronic lung disease, and asthma is one of the lung diseases, because it will make the child potentially like immune compromise at a structural level, and therefore prone to these flu-like viruses, and therefore prone to getting bronchiolitis. So you can have, concomitantly or at the same time, concurrently, asthma patient who has, bronchiolitis. It's possible, very much possible.
Well, Professor Chipeta, thank you so much for coming through today.
Yeah, it was my pleasure, Nelson.
It was quite helpful, really. Quite a number of questions, quite a lot coming through.
Yeah.
But I'm sure that the general public has really benefited, especially when it comes to the difference between bronchitis and, of course, asthma as well. Hopefully that when we knock at your door next time, you'll still be available.
Thanks, Nelson. It's my pleasure. And as I said last time, I think the Pediatrics Association of Zambia are very proud of QTV for giving us this program so that we can reach out to the public more than we can, in the normal way. Yeah, for the sake of the health of our children.
Please.
Thanks.
All right, so ladies and gentlemen, to everybody who's been part of the program, thank you so much for your questions. Thank you so much for watching, and make sure that you join us next week on Sunday. Hopefully that next week on Sunday we can come through and discuss sickle cell and anemia, and that is going to be another exciting topic of discussion as well. I know quite a lot of people are anxiously waiting for next Sunday just to get to know how they can actually manage a child who's born with sickle cell and of course anemia as well, and just what is the difference there, if at all there is a difference or if at all they are similar. So make sure that next week you definitely join us at exactly 13 right here on QTV. On behalf of Professor James Chipeta and of course everybody involved in the production of this episode, it's bye-bye and God bless.